This is Latasha Moore of Student Med News coming to you live from Little Rock, Arkansas. Here we see a persistent protester is speaking against vaccinations for children. Let's go talk to her and get some information. What exactly are you out here doing?
I am protesting for no to vaccine.
Okay, and why don't you like vaccines? What's wrong?
Because people get sick and it's just not right. Like, we should not be able to have vaccines.
Okay, and so how long have you been protesting for?
4 days.
And how long are you going to keep protesting?
4 years.
So you're very serious.
I am very committed to this, yes.
Well, do you know much about vaccines? Have you been educated? Do you know how they're beneficial?
Well, not really.
Okay.
But I do know from experience because I got sick one time, and that's all the education I need.
Okay, well, guys, let's see if we can't educate her and change her mind.
A vaccination is a small amount of a virus or bacteria that is injected into a person in order to expose them to the agent. The body then identifies the agent and remembers it so that if the person is later exposed to it, their pre-exposure prevents them from getting ill. Englishman Edward Jenner is known for having created the first vaccine in 1796. He used a process called scarification to expose a young boy to cowpox, which prevented him from getting smallpox. Today, in the United States, all states require students to receive vaccinations in order to attend school. However, they also offer medical, philosophical, or religious exemptions, which has allowed some states' vaccination rates to plummet. That is the case here in Arkansas. We are currently 49th in the nation for vaccination compliance, which means we have almost the highest number of unvaccinated children in the country. In 2013, we stood at a 57.1 compliance rate. Before 2002, parents in Arkansas could only protest against their children receiving a vaccine on medical or religious grounds, but this was later considered unconstitutional. Exemptions on philosophical grounds was approved in the 2003-2004 legislative session. Today, philosophical exemptions are the greatest in Arkansas. The process a parent has to go through to acquire the exemption is not difficult. They must simply sign a notarized statement from the Department of Health, complete an educational component developed by the Department of Health, sign an informed consent with a refusal to vaccinate statement, sign a statement of understanding that the unimmunized child may be removed from school during an outbreak. And this entire process must be completed each year.
So why don't people want their children vaccinated? Well, one reason is that people think vaccines cause autism, ADHD, and other health issues.
A 2001 report from the Institute of Immunization Safety Review Committee stated that thimerosal, a mercury-based preservative, may or may not cause autism, ADD, ADHD, or speech and language delays. However, more recent reports have discredited this, saying vaccines do not impact a child's chance of developing these issues. Just in case parents are still worried, mercury-free vaccinations are available. The idea that vaccines harm children isn't simply held by a handful of people. Hundreds of Americans feel this way, and now there are groups like Vaccination Liberation that are anti-vaccination and strongly push their agenda. During a phone interview, Arkansas District 28 House of Representatives Kim Hammer stated, "The increase in the number of vaccine exemptions may have begun once the dangers of vaccines were released." He also said that if he found good cause, he would support the idea that philosophical grounds were no longer an acceptable way to refuse vaccination. Thus, the increase in the number of vaccinations amongst children in Arkansas may increase. Despite these negative ideas, almost all medical institutions dispel the belief that vaccinations harm children. The findings of a meta-analysis of 5 case-controlled studies was published in the June 2014 edition of the journal Vaccine. The analysis included over 1.25 million children and confirmed that there is no relationship between vaccines and an increased risk of autism, and that none of the vaccination's components increase this risk. The debate about whether to vaccinate children or not has even become comical for some. The following is a comedic sketch that was featured on the Jimmy Kimmel Live show earlier this year.
am a doctor.
I'm a doctor.
I'm a doctor.
I'm a doctor.
And I believe in vaccinations.
And I believe in vaccinations.
If you don't vaccinate your kids, it can endanger their lives.
The potential downsides of vaccinations are almost non-existent.
The cumulative scientific and medical communities are in absolute full agreement
That there is basically no reason not to vaccinate your kids.
No reason.
Which is why I cannot believe we have to make this PSA.
I thought we settled this in the 50s.
Hey, remember that time you got polio? No, you don't, because your parents got you vaccinated.
I did 4 years of undergrad, 4 years of medical school.
And 3 years of pediatric residency.
I had to go to school for 8 years.
I'm pretty sure I know what I'm talking about.
But you people still won't listen.
Now I have to use my only day off to talk to you idiots about vaccines?
I want to finish watching Breaking Bad.
I'm only halfway through the second season.
But instead, I've got to come here.
Because you listened to some moron who read a forwarded email.
Perfect.
All these people had to set up cameras, lights, sound equipment, so that I could tell you to do something we've been doing for a century. Look at all these people.
This is stupid.
Get your kids vaccinated.
Get your kids vaccinated.
Get your kids vaccinated.
Get your kids vaccinated.
Secondly, some people don't want their children vaccinated because they've heard of cases where a person gets a vaccine and gets sick soon afterwards.
The Centers for Disease Control has attempted to counteract this viewpoint in reference to the influenza virus. They state that vaccines do not make a person sick, but they may become sick after receiving it because a person may contract another virus with flu-like symptoms, but the vaccine only protects them from the flu virus. The person may have gotten infected right before getting the vaccine or during the 2-week period it takes for the shot to build up immunity. The person may have contracted a strain of the flu virus different from the strain they were vaccinated for, or the honest truth that the vaccine doesn't always provide adequate protection against the flu.
Also, the public health factors of geography and economics play into our small number of vaccination rates here in Arkansas. As you know, we are a rural state, and there are counties where there's only one health department or doctor, and some people may not want to or be able to drive the distance. Our state's crisis of low vaccination rates is not just an issue of parenting and education. It is also a public health matter. In terms of epidemiology, herd immunity comes into play. That's to say that when there are a large number of people vaccinated, there's a very low risk of people contracting a virus. But if there are few people vaccinated, the risk increases.
Despite some opposition to vaccinations, there are a number of people who fully support them. In a small-scale survey, people were asked, "Do you believe in vaccinating children? If yes, why?" Here are some of their responses.
So we know our state has a problem, and we know why it exists. But now, what can we do to fix it? How can we get our vaccination rates from here to here?
A brilliant team of students at the University of Arkansas for Medical Sciences was faced with the task of brainstorming ways to improve our state's vaccination rates. Here's what they came up with. Physicians can make efforts to speak with their patients and parents during visits in order to address any concerns or dispel any myths. Politically, the state of Arkansas can pass legislation that declares once the state is under a certain percentage of vaccinated children, religious and philosophical exemptions are no longer available. On a community level, local parenting and health-focused groups and businesses can unite to spread the word about the importance of vaccination at local events like fairs and festivals.
Does that clear things up for you? A little bit, but I'm still having my doubts.
Okay, so are you gonna stop protesting vaccines for children?
No, I'm gonna keep at it.
Okay, well, good luck, ma'am. Well, guys, you can't win them all, but hopefully some of you all out there learn something new, and you're better educated about vaccines for children. This is Latasha Moore reporting, Student Led News.